Now, not only will a big government program be inefficient, it will also be costly. Now, you've heard how they're going to pay for this, right? You know how, two ways. Let's talk about this. They're going to tax the rich. Tax the rich, those mean rich people. Well, folks, I want you to look left. No, I'm serious. Actually, look left. Like Congress, really left. Look left. Now, look right. My friends, you have seen the rich they are talking about. Now, the other way they want to pay for this is cutting the fraud, waste, and abuse out of Medicare and Medicaid. Now, I got an idea for them. I ain't the smartest guy in the room, I can assure you that. But if there's really all this fraud, waste, and abuse in Medicare and Medicaid, why don't they get it out now? But what I fear is the fraud, waste, and abuse they are talking about is sick people and old people. And I am concerned about that. I am concerned about that for you. At the end of the day, if you read this bill, and if you do it, you'll be one of the few. You can look at thomas.gov, you can find it. Nobody in Congress has read it. At the end of the day, this is not a health care bill. It is a health control bill. And I and you refuse to be controlled, don't we? Before we leave here today, I'm going to ask you to do three things. Three very important things. Number one, I want you to make sure you sign those petitions. I know we have some people over here that have just gotten here. We have plenty of petitions. The hands off our health care petitions. Zach, raise your hand so everybody knows where you are. Zach's done a great job on this trip for me. You're a great young man, along with Cameron. So you guys go sign that petition. Number two, they have a call sheet. This man's got one. I see some other people one. It gives you the numbers of your members of Congress and Kay Hagan. Now, if you're in Alamance County, you've got a wide diversion in who represents you in the U.S. House. If you're in Howard Coble's district, he was over with us today in Salisbury, and he's with us on this. If you're in Brad Miller's district, God help you. I don't think that we've got a lot of luck there. I don't think, he is for this, but let's let him hear from you. He needs to hear from the opposition. So can you call Brad Miller from me, even if it makes your stomach turn? But the really important call you need to make is to Senator Kay Hagan. Senator Kay Hagan has said at one time, although she appears to be waffling on this, that she is very concerned about the public plan that's in this bill. And let's talk about that public plan for just a minute. What you hear is they're going to provide competition with the public plan to private insurance. Think about how this competition would work. The government sets the rules. They tell private insurance how to work. Their own public plan is completely exempt from those rules. The public plan has unlimited access to taxpayer funds. That is the equivalent of sending, to call that a fair fight, that's like sending George Foreman into the boxing ring with a pair of gloves and his opponent has a bazooka. I mean, there's nothing fair about that. And the reality is what will happen is we'll all lose our private insurance and be dumped into the government plan. So I hope you will call Senator Hagan. Now, I am just guessing. This guy right here, I know, has a cell phone with him. Now, I know that there are other people that have cell phones here, so I hope you will take those phones out. Look at that call list and program Kay Hagan's number in there. Program that Greensboro number, that Raleigh number, and that Washington number. And make sure you keep calling till you get her. Some of you people who are more technically sophisticated than I am even know how to set alarms on your phone. Set that alarm for a daily reminder to get you to call Kay Hagan. Because if you can't get her today, I know because her voicemail box is full, I can promise you that. Keep calling tomorrow, keep calling tomorrow. If you see her at any event, go talk to her. Be polite. We always want to be polite. But tell her, in no uncertain terms, do we want a big government-run health care program? We want our own program, and we want their hands off our health care. So can everybody here, so I'm going to ask you 3 things. 1, fill out the petition. Number 2, call Kay Hagan and call your House member in the U.S. House. Number 3, on the back of the bus, right down there, on the fans and on the signs, you see a domain name. It says joinpatientsfirst.com. That's our Americans for Prosperity petition. It's the same petition you're signing here in person. I'd like you to go home, write just a little note, a few sentences about this event, and send it to every one of your friends. I swear if he gets any closer, he's going to see something he shouldn't. I'm just kidding. Send that Join Patients First to every friend in your email address book. I don't care whether they're in North Carolina or not. Send it to everyone and ask them to sign that. Can you do those 3 things for me?